My name's Jim Grenville. I work on East 4, which is an acute medical ward in Landock Hospital, and I've been there for 20 years. Those who weren't bed-bound prior to admission, the problem is that the longer they stay in bed, the harder it is for them to get better afterwards or to get back to their previous baseline. Because I think sort of for every day in bed that they spend while they're ill, it can add weeks to their rehab. So to actually get people moving and get them out of bed quicker, it's got to be a benefit to us as nurses because it makes it easier for them to look after. And if you can cut down on the amount of time they need to rehabilitate after they're ill, that's got to be a good thing. The nice thing about our ward is that we actually have one of the Multicare bed frames at the moment, and for the right type of patient they can actually be of benefit to the nursing staff, because the Multicare bed frames that we do use could actually do lots of things it might take more than 2 nurses to do normally. Its main attraction to me is that whereas you have the type of patient who's immobile, isn't particularly helping you, might even being resistive to care, advantage of the Multicare bed is because it will go from side to side. If you're turning a patient from side to side, you can actually give the patient that bit of assist. One person can roll them then fairly easily, and then you can return the bed back to its normal sort of position, and then you've got an area so the patient's off their back, for example. You can provide personal care relatively easily. Simple things like toileting and washing and dressing, making sure the patient's in the correct position to eat and drink, to making sure the patient's in the right position to try and help with their breathing, postural drainage, pressure relief for patients who can't sort of roll sufficiently well themselves to actually reposition in bed with the assistance of fewer carers than normal. So, I can't think of many areas of nursing on a day-to-day basis where using a Multicare bed wouldn't be of benefit. I think as long as you target it to the right patient, they're ideal for patient care, and they help us as nurses to stay safe, and they help the patients. If it's good for the patient, you can't really sort of even contemplate not considering that a benefit.